Good afternoon and welcome to day 293 at the EMA office where we bring you the latest in the COVID numbers here with Chairman Kern and Barb Holt from the Health Department. Barb, and you have the numbers.
I do. Good afternoon, everyone, on this last day of 2020. Updates today for day 293. We have tested 207,848 in St. Clair County since the start of this COVID back in February and March. That's an increase of 1,970 since yesterday. Of those, 192 were positive. That includes males and females under 10 years of age up into their 90s. That makes our St. Clair County daily positivity rate for today of 9.7%. So our total positives are 20,854. Our total negatives then are 186,994. Unfortunately, we have 5 new deaths to add to our St. Clair County list. That makes a total of 325 individuals in St. Clair County since this COVID has started that have died due to COVID-related illness. We have a female in her 70s, a male in his 70s, a male in his 80s, and all with underlying health conditions, a female in her 80s and a female in her 90s, those two with unknown health conditions. So again, our sympathies go to all those family members and friends of those 329 individuals. We have 18,975 folks that have successfully completed their 10-day isolation period who were COVID positive. Statewide, we have tested 13,277,443. Of those, we have 963,389 that are positive. That's an increase of 8,009 since yesterday. And again, unfortunately, our death rate in the state of Illinois is high. We have 133 more COVID-related deaths to report in the last 24 hours in the state for a total of 16,490 individuals. Hospitalization numbers in St. Clair County, our COVID-related patients, 120 are hospitalized and 14 of those are on ventilators. Region-wise, we have 185 patients and 20 of those individuals are on ventilators. As far as congregate living centers, updates on those, we have 1 additional case and 1 death to report at Mercy Rehab and Care in Swansea, for a total of 118 cases and 9 deaths. At Morningside of Shiloh, we have 2 additional cases for a total of 16 cases and 1 death. At St. Paul's Home, we have 1 additional death for a total of 132 cases and 20 deaths. At Swansea Rehab and Care Center, we have 1 additional case to report for a total of 47 cases and 8 deaths. At Cedarhurst of Shiloh, we have 2 additional cases for a total of 24 cases and no deaths. At Cedar Ridge of Lebanon, we have 2 additional cases for a total of 145 cases and 20 deaths. And finally, we have 2 additional cases at Freeburg Care Center for a total of 66 cases and 2 deaths. Again, we would like to give you the list of COVID testing opportunities throughout the county. We have several over this holiday weekend. This Saturday, we will be at the Belleville Fairgrounds from 8 to 4, and we will also be at McKendree University on Saturday from 8 to 4, as well as Sunday at McKendree University from 8 to 4. We will also this Saturday be at 4601 State Street in East St. Louis from 8 to 4, and also on Sunday from 8 to 4 at 4601 State Street in East St. Louis. Next Monday, Tuesday, Wednesday, we will be at our St. Clair County Public Services Building. Monday, Tuesday, Wednesday, we go from 8 to 4. And we are also offering evening hours. So next Thursday, we will have evening hours. We start at 10 in the morning, and we'll be able to go till 6 in the evening. And then on Friday, we have early morning hours from 7 in the morning till 3 in the afternoon. So the schedule for the COVID testing at the 330 West Main site will be that on a weekly basis until we get vaccine. And once we get vaccine, we will immediately turn that facility into the vaccination site. So I'll talk a little bit more about that here in the near future. Again, we've been getting a lot of questions here at EMA as well as the health department about the new coronavirus, the variant type of virus we're starting to see here in the United States in a few places. As far as we know, we haven't seen any cases in Illinois, but there have been in a couple other states in the United States. And I've got a press release from Dr. Ezike and the Department of Public Health here. And this is, these viruses constantly change, they mutate, and variants are expected, according to Dr. Ezike. But she also states at this time we have no evidence that infections by this variant cause more severe disease or death. However, it does show that this particular variant spreads more easily and more quickly. So again, it's new. We'll continue to work with our IDPH partners and CDC partners. But again, what this message is that we need to remember to make sure we continue to remain vigilant. I know it's been a long road. We started this back in March. March 14th, I believe, was our first report of a case in St. Clair County. And it's a long road, but we're getting there. We have a light at the end of the tunnel, but we need to remain vigilant by wearing our masks, by doing our social distancing. The vaccine is coming very soon, but especially like this evening. Tonight is New Year's Eve, and we traditionally like to get together with family and friends and celebrate the new year. And I think a lot of us are glad to see 2020 go. But again, please keep those social events to your very own pod, your very own bubble of the folks you've been with. Make sure you wear your masks and protect yourself as well as your family, friends, and all. And finally, I would like to give an update on the vaccine specifically for St. Clair County. Again, we are following Department of Public Health, Illinois Department of Public Health, and CDC guidelines that state they outline which are the priority populations that we need to vaccinate first. And so that is phase 1A is the ones we are in right now, which is for hospitals and long-term care facilities and those folks that work at hospitals and or doctors and nurses and hospital staff to make sure they get the vaccine first. And next week will be the third week of when the vaccine first came out in St. Clair County. So they're expecting the shipments to be able to give the second dose. We had Pfizer vaccine, and the second dose is supposed to be given 21 days later. So that vaccine is coming to those hospitals next week to be able to give the second shot to those individuals. So, we want to make sure those folks are taken care of. Those are the folks that take care of us on a daily basis, as well as the long-term care facilities. They're a very vulnerable population, and the pharmacies from CVS and Walgreens will be getting that out to those long-term care facilities as well. As soon as 1A is completed, that we have vaccine sufficient to provide services to all those in St. Clair County that wish to have the vaccine, then we will start as a health department and with our community partners vaccinating those that are in 1B. The fire, the police, those 75 years of age and older, the teachers, those priority essential health workers. So as soon as we get it, we will be giving information out here at this 3:30 update as well as through our media, and we're not going to hold it. As soon as we get it, we're prepared, as I said earlier, to roll out. We'll change our 330 West Main COVID testing site to a vaccination site. One of the things we need to remember is we won't get all the vaccine we need at one time. It's in a limited supply, so the state and CDC is spreading it out on a limited basis to everyone in shipments. So as we get our shipments, there's a limited supply. We'll prioritize those folks in phase 1B, and we will be advising folks through the media to let you know where you can go and how you can sign up for appointments. We don't have the vaccine yet, and we don't have appointment availability yet because we don't know when we're going to get it. But as soon as we do, we're going to be getting it into the arms of folks in St. Clair County as fast as we can. So that's our update. Again, we'll get it out as soon as we get it, and that should be in the next couple of weeks. So please be patient, but we're doing the best we can, and we'll get it to you. And with that, I will turn it over to Chairman Kern, sir.
Great, Barb, thank you, great job. We'll go into the zip code report today. 62201 up 1 to 452. 62203 up 3 to 507. 62204 up 1 to 326. 62205 down 1 today to 516. 62206 up 23 to 1,010. 62207 up 4 to 460. 62208 up 14 to 1,193. 62220 up 12 to 1,436. 62221 up 16 to 1,996. 62223 up 14 to 1,258. 62225 up 1 to 100. 62226 up 12 to 2,269. 62232 up 4 to 677. 62239 up 7 to 326. 62240 up 2 to 106. 62243 up 3 to 496. 62254 up 8 to 611. 62257 up 3 to 236. 62258 up 8 to 753. 62260 up 5 to 518. 62264 up 2 to 247. 62269 continues to pull ahead and be the highest zip code in St. Clair County, up 33 today to 2,295. 62285 up 5 to 412, and 62289 up 2 to 39. 192 new positives today, with 1,970 tested, brings us to a daily county positivity of 9.7%. That's down, not down near enough, but that brings our 7-day rolling average to 12.5%. Regional positivity today is up to 12.2%, derived by Bond County at 7.7%, Clinton County 18.5%, Madison County at 15.8%, Monroe 11.2%, Randolph 11.3%, St. Clair 10%, and Washington County at 26.8%. So all these numbers way too high. New Year's Eve, we're wishing everyone certainly a happy New Year's Eve and a happy New Year at midnight, 12:01. But Herb, we've got to caution people, as the doctors told us yesterday. They really need to be aware that the spread is out there. It's a general community spread. There are a lot of people who don't know they have COVID right now that do. It's pretty clear from all of the testing that we're doing that the positivity rates are showing that we're very high here in St. Clair County. So if you can, stay home. If you're going to be out, be sure to wear the mask, wash the hands, watch your social distancing. It's just important that we get through this. It would be such a shame now on day 293 to go through all of this and then have people continue to get sick, perhaps pass away. 329 deaths this year from COVID is way too many, and we certainly we would like to start the new year fresh, and I guess we'll do that, but we can't do it if people don't pay attention to the mitigations, and certainly if they don't wash their hands and watch the social distance and wear these masks.
Well, and as we said, for 293 days, every one of us, everybody, all of Team St. Clair members and everybody out there is stressed over this. They're tired of it. We're tired of it. But as we've said all along, the virus isn't tired. It's still here. and it's looking to continue to go on, and we have to be the people who battle that, and each of us have that responsibility. 103 more individuals under the age of 40 tested since yesterday. Our regional positivity went up to 12.2 from 12.1. So we watch that because that's what we've got to get that down, and we can only do that by working together. And you're right, 329 deaths in our county, 133 across the state of Illinois since yesterday. That number just keeps rising. We were looking throughout the week where the deaths were slowing down even across the state, but in the last couple of days they picked up again. So,
New Year's Eve is a time for reflection, and when we reflect on these past 293 days, what we've learned about this pandemic, I remember the first time we were here, we had just gotten our first COVID death in St. Clair County, and we were shocked. And that number remained in the single digits for a while, and then all of a sudden, it escalated, and then this past month, in December, we really saw a great increase in the rate of death in this county. Very concerning to all of us, and now the new strain that Barb talked about that is far more contagious, and this already is a contagious virus. The doctors have told us throughout that the one thing this virus does well is latch on to other people. It's very contagious. And now to find out there's a new strain that's even more contagious makes it even more imperative that we all take this seriously. Let's just lock it down and stay home and do the things we're supposed to do so that we can move into this new year, get a vaccination, and move ahead. And by the middle of the year, we'll be back to our normal lives. That's certainly all the prayers and wishes that are coming from Team St. Clair.
Barb, there was one question. Is there any plan to maybe get a testing site down in the southern part of the county around Marissa on the page?
We are. We're working with our community partners to set up those types of tangential clinics out within the community. Again, it's a complicated.
It is.
It's a logistical nightmare. You have to have the vaccine at certain temperatures and
Well, they're talking about testing sites here.
Again,
Testing,
I agree, but we have to make sure we have the proper materials, and once we get the vaccine out, you have to give it within a certain amount of time. We have to make sure we have appointments for those individuals, so the amount of vaccine we take out that we use, as well as providing the services to those individuals. But that is the plan. We're working with community partners, but it'll take a little bit because we got to make sure this stuff is like gold. It truly is. And we don't want to waste any. We want to make sure we handled it properly to make sure that it's that the vaccine will work and that we don't waste any.
And as far as testing goes, we could get a testing location in Marissa set up again, couldn't we?
I'm sorry, you're talking testing
Testing.
or vaccine? I'm
Testing,
sorry, I was
testing.
talking about vaccination clinics.
Yeah, testing.
Testing clinics. There are several in the area. We can, the ones actually in our area that we have here close by, we're getting pretty good results rather quickly. I was by the fairgrounds one today. We already had 50 individuals that went through there, and especially in the cold weather. So we will try if we get enough. We're trying to put them where there's the most opportunity for folks. But we'll see if we can set one up. We get enough interest in that area. We'll be glad to.
We know the mayor of Marissa has been a strong member, proponent of trying to keep his community healthy, and he's always in contact here. So,
Yeah.
so we'll work
appreciate
together.
We'll try to do that. Absolutely. My apologies. I thought
No,
you
you're
were talking
good.
about
It's all good.
vaccination
It's all
clinics.
good information.
It all
that's for
runs
sure.
together.
Yes.
Testing, vaccine, and that's what we want.
Yes.
And as we said, New Year's Eve is here with us, and if you're going to go out, which I hope this year you take the good advice and try to stay home, immediate family.
Carry out from our local
Yes,
restaurants.
take care of that, and we'll be keeping you updated. There's a possibility of some freezing rain tonight, so monitor this page, and we'll keep you updated on the latest, any development of that, as we do all the time when those potentials for severe weather that comes. So we'll be back tomorrow afternoon for day 294. We want to wish everybody, all you Team St. Clair members and everybody, a safe and happy New Year's Eve. And we'll see you back here tomorrow afternoon. We'll be back with Daisy in a few moments to translate this into our Spanish communities. Have a good evening.
I was born and raised in East St. Louis, St. Clair County, City of Champion. We band together like family on picket where the Mary Brown Center in Lincoln Park was my playground. Just as we were together then, we must all band together now and work to combat COVID-19. As an Olympian, I understand the importance of teamwork and overcoming hardship. So I plead with you to do what I'm doing to fight this virus. Wash your hands, wear your mask, watch your social distance. It takes teamwork, and if we stick together, we will victoriously cross the finish line.